Okay, good afternoon, everybody. Thank you for joining us today for the online Bachelor of Arts in Health Society online information session. My name is Tracy Souza. I am an enrollment specialist here. A couple of things before we begin. I am recording this information session. You will all receive a copy of it via email within 24 hours. We ask you if you have any questions to please put them in the chat room. At the very end of our information session, I will go through the question and answers, and I will stop the recording and I will provide you with an application fee waiver code so that you do not have to pay the admission fee. So let's go ahead and get started. So again, my name is Tracy Souza. I am an enrollment specialist here at UMass Dartmouth. Joining me today also is Dr. Kristen McHenry, and she is the Director of Health and Society and an assistant professor here at UMass Dartmouth. So our session agenda today, I'm going to go through an overview, an introduction to online learning, an overview of the program. I'm going to go through your admission requirements. I'm going to go through some ways that you can finance your education. I'll provide you with some helpful resources. And then again, like I said, we'll go through the question and answer portion. Oops, sorry. So why UMass Dartmouth? So UMass Dartmouth provides quality academic experience with personalized student services. So you will have a one-to-one academic advising and support ratio. You will get assigned an academic advisor upon admission. And that academic advisor will remain your academic advisor throughout the rest of your time here at UMass Dartmouth. So you will have a personalized experience with them and they can get to know you better. Our student to faculty ratio is 13:1. We're pretty proud of this. We have 24/7 tutoring that's available. I'll explain more about that in later slides. And we now have 50 plus online programs. I believe as of today, we're up to 55 online degree programs. We have a generous transfer credit policy. You can transfer in up to 90 credits. But you have to have 30 credits here at UMass Dartmouth in order to get a degree from here. So all our classes are taught asynchronously. So what does that mean? So asynchronously means that the lecture is recorded and you can learn on your schedule. So you will follow a syllabus and you will use the course platform, which is Canvas. There may be other platforms that you may use. You might use discussion boards. You might go to websites. They might ask you to do some blogs, emails, videos. It just depends on the class and the professor teaching the class. So how it works is they will provide you with the syllabus at the beginning of the semester. Typically, they reach out and tell you on a Sunday, like this, say, for example, chapter 1 is due and all the material is due by the end of next Sunday. So you have a week to get that done and you watch the lecture and do the material at a time and place that is convenient for you. The following week, the professor will, remind you of the next chapter that is due or the next assignments that are due. So you'll know what is due, and getting that information in that assignment turned in on time is all about your time management and what's convenient for you. I do want to let you know that the program online is taught by the same full-time faculty who teach on campus, and they also teach the same curriculum. So nowhere on your transcript or your degree will it say that you are an online student. Oh, I'm having a hard time here. So online course schedules. So We have courses in the fall, spring, summer, and winter, so we're very customizable. Um, we ask that to be considered enrolled continuously, that you sign up for classes in the fall, in the spring. Most online students are doing this at a part-time basis, and they just want to keep going to get it done. So we do offer extensive classes in the summer, and we also offer three little 3-week mini sessions. We offer one in the summer and one in the winter, and that's very condensed. It's 14 weeks of material in 3 weeks. So some people like to take advantage of that. Some people find that too intense. Um, the programs that we have are designed to support the adult learner, and you choose how many courses to take in which semesters to attend. So for example, if you say that, you want to be a full-time student and you want to take 4 classes in one semester, but then the following semester you're busy doing something, you can cut it back to 1 class if that's what you need to do. So you can take as many classes or as little classes as you want each semester. That's why it's very customizable. So why earn a bachelor's degree online in health and society? I'm now going to turn it over to the professor and let her explain this.
Sure. Um, and then Tracy, I'll just let you know when it's time to change the slide, I guess. So hi everybody, I'm Dr. McHenry. I am the director of the Health and Society program. And just, for context, my own research is on gender and environmental health. So I sort of look at different sort of exposures that women have to environmental toxins. So that's sort of where I come at things through health. My background's in political science and women and gender studies. But why earn a bachelor's degree in health and society? Health and society is a really incredible and unique interdisciplinary major where we draw on sort of social science and humanities, and in some case, natural sciences perspectives of health. So we're getting a degree where we're specializing in sort of the causes and underlying explanations of what causes health disparities. Why do we see inequities? How does the health insurance system work? And this is going to prepare you for careers in a number of different fields depending on your interests. So one of the great things about health and society is we can really tailor it towards your own academic interests and career pursuits. So some of our students want go on to work in public health. So maybe they work at the Department of Public Health, doing various different jobs. Some of our students are preparing to be health advocates and work for nonprofits related to community health, health educators, policy analysts, so kind of looking at health policy both at the state and federal level. I mentioned community healthcare worker. We also have students interested in health administration and management. That's kind of the behind the scenes, who is doing some of that administrative work, running hospitals, clinics, things like that. A lot of our students are interested in going on to advanced education after they finish their bachelor's, and that sometimes looks like students who are interested in accelerated nursing programs to become a nurse, epidemiologists, physical therapists, physician's assistants, pharmacists, health policy specialists. And I'll just sort of add that we have a number of opportunities and agreements with graduate institutions to kind of make that to prioritize your admission and to sort of help you facilitate that change. And I'm happy to answer more questions about that. Tracy, would you do the next slide if that's all right? Um, so, in our health and society program, students are really going to learn a number of different things, and all of it is applicable to the real world in healthcare policy and research. So, first, we're going to understand how systemic inequalities affect health outcomes. So, we're looking at the population and structural level to think about, well, what does your status in society, how does that shape your health, right? Why do we see poor health outcomes in some regions, some states more so than others? We're always thinking about oppression, justice, inequality as it pertains to health. Why are asthma rates higher in some locations than others, right? We're going to learn theoretical frameworks and research from multiple disciplines to find innovative solutions. So that's one of the really exciting parts of our program. You may take a course with a political scientist who focuses on health policy, and you might take a course with a medical sociologist who's looking at the sort of evolution of disease like cancer, things like that. You're going to demonstrate an understanding of the organization and efficacy of healthcare systems. So we have some great courses that really dig deep into, how do the policies create outcomes about the money you spend on your prescriptions? Why do we have the type of healthcare system that we do? We also offer training in research, qualitative and quantitative research methods that would prepare you for advanced degrees or doing research analysis for Department of Health. I've had some students do that before. And we're going to utilize effective oral and written modes of communication, health-related issues to diverse audiences. We have a course specifically about health communication. It's a vibrant career opportunity. Who does the work of sharing health information to audiences and translating some of the latest findings to audiences who want to learn more about public health? So those are just some of the things that you're going to learn in the program. But again, if you have an interest in a particular health issue, we can certainly sort of tailor some of what we do to your interests in your classwork. Tracy, I think we're good. Okay. So the Health and Society curriculum, we have the core courses. Intro to Health and Society is a great introductory class. For example, you're going to learn things like what are the ethical implications of teenagers' health and can they consent to different things? What about assisted suicide, things like that, controversial public health issues through ethical frameworks. We're going to look at communicating about a broad array of public health issues. In HLT 211, communication about health and illness, that's a class that's really, I mentioned, is focused on public health communication skills and writing skills. And it's taught by an expert in that field with a lot of great connections to career opportunities. If you're thinking more that you want to pursue a clinical patient-centered career someday, then ENL 264 is a great alternative for communicating in the sciences. Those are the folks that maybe want to be a physician's assistant or a nurse that are going to be writing more lab or clinical notes, that kind of writing. Social science research methods gets at understanding, how do we come to the conclusions that we do about data, about health, and how do we interpret rates of cancer incidence or smoking or anything along those lines as just examples. We do an internship. But this is a great opportunity. If you're already working in the healthcare field, you could perhaps use the job that you have to work towards your internship or find someplace local to you or even remote to do an experiential kind of learning and get experience in the field. So I have students that do anything from working with autistic youth to doing their internship at the Department of Public Health to interning at disability rights health organization. There's a range of different things, pharmacy settings, all kinds of things. We are interdisciplinary, as I mentioned. So that means that your coursework is going to span across different disciplines like crime and justice, economics, global health, women and gender studies. But all of these courses will contribute to your expertise and knowledge in health. So when you take a class, for example, in women and gender studies, we have a class called Global Women's Health, right? You're kind of thinking from that discipline. We have a class called Health Economics, which looks at issues like if we change the price of cigarettes, do people smoke less, right? Like those kinds of cost issues. And then the internship is, as I mentioned, is a really great opportunity to add to your resume, to build on your experience and get some real world application. Thanks, Tracy. These are just some examples of the electives in our curriculum that you could take. You can see there's a whole range of choices. I'll highlight a couple. So, AGH is our aging and health. Those are folks that are interested in gerontology, developmental of your lifespan, maybe elder care, things like that. We have a lot of classes on that are related to politics of health. So PSC 311, state politics, PSC 315, women in public policy. That's where you're going to learn about contraception policies, sex ed curriculum, and what the government sort of gets involved. Look at COVID, for example. You have some coursework in sociology that's going to give you that structural oppression based perspective of health, right? So, like the lower your status in society, the worse your health outcomes are in your community. You'll look at things like food deserts. How do we shape sort of health outcomes with diet, things like that. So, there's a lot of really great classes. I teach, for example, HLT 330, Race, Gender, and Medicine, where we look at medical racism and its impact on present day health. So lots of great opportunities, and there are plenty of opportunities to have courses perhaps that you've taken elsewhere, equivalent transfer to fulfill those elective requirements. So you could talk to your advisor about that.
Okay, I'm going to go through an overview of the enrollment process here for online programs. So what you will do, the whole enrollment process is as follows. So you're going to apply online. You're going to submit your application. Even if you think it's incomplete, submit it because it gives you access to your application portal. In your application portal, you will be able to upload documents. If you need a resume, if you need a statement of purpose or anything, that's where you're going to upload it. So you're going to submit your admission documents. Then once your application is complete, you're going to get an admission decision. And then in your application portal, you will log in there, you will see your admission letter, and then there's another form in there called the intent to enroll form. A lot of students get hung up on this intent to enroll form. That is just a form saying that you are accepting your admission at UMass Dartmouth. It does not commit you to UMass Dartmouth. What it does is it allows your transcripts to be pushed over to your academic advisor and let you get assigned to an academic advisor. So after that gets pushed over, you will make an academic advising appointment. And in that appointment, they will go over your transfer credits and things of that nature. I'll get into a little bit more of that in the slides coming up. The academic advisor is going to help you register for courses. Keep in mind, it is important to register early. And you can register early. It helps you with your financial aid. So with online programs, your financial aid is not determined until you actually are enrolled in classes, as it's based on the exact number of credits that you actually enroll in. I know sometimes if you're on campus, they figure everybody's going to do between 12 and 15 credits so they can package your financial aid sort of ahead of time. Not like that with online. So we encourage you to enroll early because that'll allow your financial aid to come through. If you decide you're not getting enough financial aid or you can't afford it or whatever, you can drop the class up until the add drop date that is on the academic calendar and still get 100% refund. After the add drop date, you can still drop the class, but you cannot get a refund. So that is very important information. Some people don't understand that. You can go on our webpage in very simply in the search bar, just put academic calendar and you will find a whole outline of what is due when. Like when classes start, when the add drop date is, if you have a day off, it'll go through all of that. When you do register for courses, keep in mind that tuition is not due at the time that you register for the course. So a lot of people don't register because they don't want to get that bill right away. You won't get the bill right away. Here's an example. So summer registration opens up in March, at the beginning of March. You will not receive a bill for summer until after, like a month or two after. If you enroll in fall classes, fall registration opens up in April. You won't get a bill until after July. They're going to bill summer classes before they bill fall classes. So even if you register for both at the same time, you're going to get billed separately. So there is a gap between that. That's why we encourage students to actually enroll early. If you forget these steps here, or you're not sure where to go, you don't need to worry about it. I am one of 3 enrollment specialists here, and we were going to guide you the entire step of the way. So you don't have to worry about forgetting a step or did you turn something in. We're going to keep track of things and reach out if you're missing something. So let's break it down a little bit more. So admission requirements. Okay, like I said, we're going to start that application. To do that, all you simply need to do is go on to umassd.edu/online. There's going to be a gold tile at the bottom of the left-hand screen that says Apply Today. You're going to click on that, and it's going to bring you to starting of the application. So you're going to select the online application, and you're going to set up an account. It makes you set up your username and password and stuff like that, and then you can start with the application process. We do have rolling admissions. So we understand that life happens, and you might intend to start, for example, in the summer, but something happened and life got in the way, and you're not ready to quite start in the summer, and you didn't get all your admission materials in. We're going to reach out to you. We're going to ask you, we noticed you didn't complete your application. Classes are starting. Do you want to defer to the fall? So you have up to 1 year to defer your application. So you don't need to worry if life happens. Okay, so anybody who fills out an application, if you are a brand new freshman coming in, you don't have college classes, or you have under 12 credits at a college, you are going to need to turn in high school transcripts. If you have more than 12 credits at a community college or whatever college you're at, you do not need to turn in high school transcripts. So anybody who needs to turn in high school transcripts, you will need to do that. Anybody who has a GED, you will need to turn in an official copy of your GED and high school transcripts if you have one. So for example, if you went up to 11th grade in high school and then you had to leave for whatever reason, and then you got your GED after the fact, we'd like to see an official copy of your GED and an official high school transcript. So we can look at both of those. Official college transcripts. So for anybody who has done a significant amount of college work over the 12 credits, we're going to ask you to reach out to all the colleges that you have attended in the past, whether you think you've earned a degree there or not, because we may be able to transfer that one class that you took from a different college and use that towards transfer credits. So again, reach out to those colleges and request an official electronic transcript. So this is why, let me just back up a little bit and say, this is why we say submit your application even if you think it's not done. Because when you are asking for these transcripts to be sent to you, if your application is not complete, 90% of colleges now use a third-party vendor. And it's like Parchment or Student Clearinghouse, and you can order your electronic transcripts, and the college will automatically upload it to the clearinghouse, and then it automatically gets downloaded to UMass Dartmouth and attaches to your application. If you don't have your application submitted, it can't automatically download, and then we have to manually download it, and it just takes more time. So if you want a smooth, easy process, as soon as you fill out that application, go ahead and submit it. So again, I talked about the official transcripts. You cannot upload official transcripts yourself. We do get a lot of calls on this. They have their transcripts in their hands. They're trying to upload them and they can't find transcripts. You're not going to. It's specifically made that you cannot upload transcripts yourself. So you do need to order them from the school. Anybody who's took AP exams or CLEP exams and stuff like that, we can take that as well. You just need to get those official copies and have them sent to us. Anybody who is international. So international students have to do the same requirements I just listed above, except in addition to that, you have to do a official transfer or official transcript evaluation. So you're going to reach out to either CED or Wes over here, and you will send them your official foreign transcripts, and you want a detailed evaluation done. So what this company, either of these two companies do is they go line by line, they look at the class you took, and they put the grade that you achieved in your country, and then what the equivalent grade is in the USA. It'll also break down your equivalent GPA and your equivalent degree. So that allows us to transfer in any foreign credits that you may have. Once you get that report all set, you're going to ask for an official copy of that report to be sent to UMass Dartmouth, and that's how we can get your transfer credits uploaded and put onto your account. Anybody that has gone to school in a foreign country where the official language is not English, even if you were taught in English, but the official language in that country is not English, you do need to take a TOEFL, a Duolingo, or an IELTS exam. That is a proof of English proficiency. We need that whether you were taught in English or not. And you're going to ask for official copies to be sent to us, and again, they will automatically upload. If you're looking for the fastest route, Duolingo seems to be the fastest. You can take it in your own home. You don't need to make an appointment, and we usually have the results in about 24 to 48 hours. Okay, so after you submit your application and you are admitted to the program and you fill out that intent to enroll form, I talked about setting up an academic advising appointment. So what they are going to do is they are going to go through, it's called a tracking sheet. So they will supply you with a copy of the tracking sheet. They have a tracking sheet, and it's going to show you all the classes that you need to graduate for that degree. It's going to go through any transfer. They'll review any transfer credits you may have and how they are applied. They're going to map out an educational plan for you to get your degree here at UMass Dartmouth. And then they are going to actually enroll you in classes. So you will meet with them at least twice a year, in the fall and the spring, because you will not be able to enroll in your own classes. They have to enroll you and make sure you're on track. So they will enroll you, again, at least twice a year, but you connect with your advisor as many times as you want. So typically 99% of the time, the advising appointments are done via Zoom or on the phone, but you can also do it in email, or you can do it in person, however you want to do it. But again, 99% of the time it's done via Zoom or on the phone. So transfer credits, I talked about you can transfer in up to 90 college credits. Again, you have to take 120 credits that are required to earn a bachelor's degree. You have to take 30 of those credits here at UMass Dartmouth. Let me see. There's no expiration on transfer credits. So if you took, you earned your associate's degree 15 years ago, it's okay. We can still transfer in those credits. They have to be earned from a regionally accredited college or university. Again, we take CLEP and AP exam credits. Again, we can take international courses. You have to have that CED or WES evaluation so we can make sure that it does transfer over. And then any class that is going to transfer over, it has to be a C minus or higher, and it has to be a 100 level or higher. So no remedial courses will be able to come over, but anything that's at a 100 level or higher and is a C minus or higher, we can look at transferring it in. Anybody with military credits, with the appropriate documentation, you may be able to get some transfer credits if you've gone through military training. And then you, again, map your degree completion plan. Again, so you meet with your academic advisor and they will map a plan out for you. So you're constantly being updated every semester when you enroll in classes about how many courses that you have left, and keep track of that. So I think I missed a slide. No, I didn't. Okay, so student support services. We have a whole host of student support services. So we have library services. So you can research, support, and gather in the gathering of electronic research materials, or you can come to campus. Like I said, if you're an online student, you're considered a UMass Dartmouth student. So you are welcome to come to campus and use the library on campus, or you can do it electronically to get research materials. Either option is available to you. We have the Office of Student Accessibility. So if you need educational accommodations and you qualify for that, we can take care of that. We have a career center. They can help you with exploring employment opportunities, internship opportunities, help you with your resume. They can do that in person and online. And even after graduation, if you've graduated and you need help looking for a job, they can help you with that. And then last but not least, we're pretty proud of this, the 24/7 online tutoring support. So this started last year, and we have a service called Brain Freeze. So you will see it when you log into your Canvas platform. On the left-hand side, there'll be a little button over there that'll be Brain Fuse, which is 24/7 tutoring support. So if you're in a class and you're not understanding the materials, and it's 1 o'clock in the morning and you don't understand something, or you're having trouble with math or whatever it might be, you can just click on that little tutoring service and you can get a live tutor, or you can review questions, practice questions, things of that nature. So you always have that 24/7 support. If you have to write a paper and you just want somebody to overlook it and give you pointers to make sure it's good before you turn it in, you can upload your term paper and they will review it and let you know if you're weak in areas or add things or take things out. So that is a tremendous tool. A lot of online programs do not offer that, but we do offer that. Lastly, I do want to say that you are considered a UMass Dartmouth student. We are happy to have you. And we invite you to come at the end and you're ready to collect your degree. Come to campus, walk across the stage and collect your degree. Hold up that degree, get a nice picture taken. We do have stoles. It'll say UMass Dartmouth online student. And we had a bunch of people come last year and walk across the stage. So tuition and fees, how are we going to pay for all of this and how much does it cost? So this program falls under the arts and sciences, and typically the cost per credit is $447 per credit. Classes are typically 3 credits. It depends on the class you have to take. So it can go to 471, like if you have to take something that's more extensive, like that needs a lab or a biology or something like that. But most of the time, it's $447. If you log into our online page, umassd.edu/online, at the top of the page, there's a little tile up there that says tuition and fees, and it can give you a whole breakdown of all of these fees and what the college fees are in particular. So the college fees get applied to the class you are taking, not the program you are in. I just want to keep that in mind. One last thing is tuition and fees are based on the 2025-2026 academic year, and they're subject to change. Again, we're a state school, so once a year the state looks at the pricing and determines if there's going to be an increase. That usually happens in July, but I can tell you that they try very hard not to raise the price of the tuition and fees. If it does increase, it's not at a huge amount. It's a very nominal fee, and it's not, going to break the bank. So different ways to finance your education. So we invite everybody to fill out the free FAFSA form. That's going to not only provide you with anything government funded, but it's also going to put you on the radar screen for any internal financial aid awards that might be available to you. You have to take 6 credits in order to be eligible to apply for financial aid. If you're not sure how to do that, we encourage you all to go to our financial aid webpage here. And they have little tutorials about how to apply for financial aid and things of that nature. I found it to be very helpful when I needed help applying for financial aid with my children. It seems at first like it's daunting, but once you get to know what you're doing, and I watched that little tutorial, it was really quite easy. So don't be afraid of jumping in and getting on that FAFSA form. We do offer payment plans. So if you prefer to pay over the course of the months within the semester, you can do that. So they'll break out the cost of the semester, divide it over the months of the semester, and you pay monthly. Just keep in mind that you have to have one semester paid off before you can start another semester. Anybody who is military or veteran, we have veterans educational benefits. We're a military-friendly school, so we have a dedicated Veterans Affairs office. They can help you navigate through any benefits that may be available to you. We ask all of you to check with your employer. A lot of times employers have tuition reimbursement benefits. Sometimes we can bill them up front. Sometimes you get reimbursed based on your grade. But we do have the ability to bill your employer directly if that's the way your tuition reimbursement benefit works. We do have something called a Ryan Reeves Scholarship for online undergraduate students. That is something you want to take advantage of. There's a little caveat to that, though. You cannot apply in your first semester. So after you have taken 15 credits, which is typically 5 classes, and if you have a 3.2 GPA or higher, we're going to reach out to you and say, hey, apply for this Ryan Reeves Scholarship, and then you'll get a notification if you have been selected for the scholarship. More than one person gets selected. So just remember, 15 credits, 3.2, and you can get that. We have a couple of more over here, a couple of more ways to get some financial aid. So we do have corporate partnerships with South Coast Health, Mass General Brigham, and Amazon. If you belong to one of those, if you work for one of those facilities, you can get a 10% tuition credit. And that's provided by us here at UMass Dartmouth. We give you a 10% tuition credit. So you may be able to take advantage of your employee discounts that they might give you and this 10% tuition credit. So just keep that in mind. We have something called Success by Degree that offers a 15% tuition credit. So if you graduate at a community college that's in Massachusetts or Rhode Island with a GPA of 3.0 or higher, and you matriculate and enroll in classes at UMass Dartmouth within 2 years of earning your associate's degree, you can get a 15% tuition credit. And that's not just for one semester. That is for up to 4 years. As long as you maintain that 3.0 GPA, you can continue getting that 15% tuition credit. One caveat to that is I want to let you know, though, if if you're eligible for the corporate partnership and Success by Degree, it's one or the other. It's not both. So keeping in touch. So our main email here, if you're not sure who to reach out to, we have a main email. It's online at admissions.umassd.edu. And that's a main mailbox that is looked at every single day. And we'll get back to you as soon as possible. Typically, it's the same day. Sometimes it's the next day. We also have a main phone line here. 508-999-9202, and that is our main line into our online and continuing education department. And that phone line is manned 9 to 5, Monday through Friday. So you will always get somebody that answers. If you happen to get a voicemail, we will get back to you within that same day. So that's going to end the presentation portion. I'm going to stop the recording now, and we can get into any questions and answers, and then I'm going to provide you with the application fee waiver code. So just let me stop this recording.